Yes, so the objectives of this, of course, is not only to have regulatory requirements, so the additional benefits of having a standardized data collection system and infrastructure is for multiple use. So one I mentioned already is the regulatory requirements, so you would see if there are long effects of these agents in the real world setting, but also you want to use this for other use to increase access to patients. So then if you have a standard database, these patients you could assess for reimbursements. So if patients fulfill eligibility that is captured in this database, you could fulfill the reimbursement for these patients. But not only that, and the most important is to create a repository of this data as a resource to the biomedical community. And the reason for that is that you can use this database to ask additional questions. So the alternate model could be that every commercial entity will develop their own registry or own database to fulfill regulatory requirements. But having a single database will be very important for the community, because then you could assess outcomes of patients who receive one product versus the other product. And one of the important things that we're seeing in the real world evidence in CAR T cell is the multiplicity, meaning that patients will have received not only one CAR, but a succession of different CARs in their course of their therapy. But not only that, they will have received a bone marrow transplant before or after. So it's important to have a unique and standardized way of collecting this data to understand what happens with these patients. Not only one transplant, but also a transplant on a CAR T cell or multiple CAR T cells in that essence. So what I intend to show is to have our initial experience with real-world evidence. So in January, as I mentioned earlier, we launched the Cellular Therapy Registry in 2016, and we established a contract with Novartis and Kite, and we're collecting real-world evidence on both of these products that are in patients who are receiving that in the United States. So with that, partnership with the companies and the network of sites that are participating in the CIBMTR. In January of this year, we have reached 2,000 CAR T cell recipients in the registry. So we have this very large data on real world evidence, and I would like to show this here at CAR T 2020, some of what we learned with it. So of course, patient characteristics are different than they were in the pivotal trials, which is very interesting to see. But not only that, is that the outcomes of these patients are now really falling very similar to the outcomes that we saw in the pivotal trial. And this is really the tip of the iceberg, so to speak, of how much really information we can gather with this real-world evidence. So similar to the EBMT and the CIBMTR working together to gather all these data in patients who receive this in Europe and United States, so then we can use this to ask additional questions and be available to the biomedical community.